From chaos to control, conquering adult ADHD, a nurse's journey of transformation. Steve, a 35-year-old male, had always been known for his kind and compassionate nature. As a nurse, he dedicated his life to caring for others, but deep inside, he was battling his own inner chaos. Steve had been struggling with adult attention deficit disorder, ADHD, for years, but it wasn't until recently that he decided to confront his condition head-on. Throughout his life, Steve had faced numerous challenges due to his ADHD. He constantly found himself forgetting important tasks, misplacing things, and struggling to stay focused on his work. He felt overwhelmed by the constant whirlwind of thoughts and distractions that seemed to take over his mind. One day, after a particularly difficult shift at the hospital, Steve finally admitted to himself that he needed help. He couldn't go on like this, feeling like he was losing control over his own life. With newfound determination, he began researching ways to manage ADHD effectively. Steve decided to seek professional help and found a therapist specialized in treating adult ADHD. In their sessions, he learned coping strategies to manage his symptoms. The therapist helped him understand that his brain worked differently, and it was crucial to adapt his approach to tasks and responsibilities. Alongside therapy, Steve's therapist recommended considering medication as a part of his treatment plan. Initially, he was hesitant, fearing the stigma often associated with taking medication for mental health conditions. However, after careful consideration and consultation with a psychiatrist, he decided to give it a try. As Steve began his medication, he noticed a significant improvement in his ability to focus and stay organized. He finally experienced what it felt like to have more control over his thoughts and actions. But medication was not a magic cure. It was just a tool that complemented the coping strategies he had learned in therapy. Steve made changes to his daily routines and environment. He implemented a system of reminders and to-do lists to keep track of his tasks. He set specific times for breaks during work to prevent burnout and allow his mind to recharge. He also started using calming techniques like mindfulness and meditation to cope with stress. Slowly but steadily, Steve found himself conquering his ADHD. He began to thrive both at work and in his personal life. His colleagues noticed the positive change, and Steve felt more confident in himself and his ability. However, it wasn't always smooth sailing. There were days when he faced setbacks or moments of frustration, but he reminded himself that it was okay to stumble now and then. What mattered was that he kept moving forward and never gave up. Over time, Steve learned to embrace his ADHD as a part of who he was, rather than viewing it as a flaw or a limitation. He discovered that his unique way of thinking brought creativity and innovation to his work as a nurse. Steve became an advocate for mental health awareness, sharing his story with others to reduce the stigma surrounding ADHD and other mental health conditions. As he continued to manage his ADHD with therapy, medication, and self-compassion, Steve felt a profound sense of accomplishment. He had transformed from a man trapped in chaos to someone in control of his life and his destiny. Steve's journey was a testament to the power of seeking help, confronting challenges, and embracing one's true self. He had conquered his ADHD, and in doing so, he discovered a newfound strength and resilience within himself.